Good day everyone, I'm Nathaniel Ruiz from AMM Makati. So for today's demonstration, I'm going to perform a postpartum assessment. And on this assessment, I'm going to use a bubble heat technique. Bubble heat technique stands for breast, uterus, bladder, bowel, lochia, episiotomy, human sign, and emotional status. Assume this is the breast. Assess for the breast first, check on at a time, check for lumps, bumps, discharge, breast condition, etc. and note for any abnormalities. Check the temperature of the breast using the back of your hand. Then check the nipple if it's inverted or flat. If it has any cracks or bleeding, start with your health itching because it's clear indication that the infant has poor latching. The next one is the uterus. For the uterus, the first thing we're gonna do is expose the abdomen and place one hand at the fundus and the other one at the bottom of the uterus. The uterus should be going back to its pre-pregnant state or 1 to 2 centimeters every 24 to 48 hours. So palpate deeply the fundus and feel if it's firm or baggy. Massage it baggy so that it will start to contract to prevent bleeding too much. Ask the patient when is her last void and ask how much. You should take precaution in doing this with a cesarean patient. For the bladder, ask the patient when is her last time she emptied her bladder. Usually, is postpartum patient don't feel like they are going to empty the bladder. Fill the bladder and remind them that their intake must be the same with their output. For the bowel, listen to the patient bowel sound. There's no reason for the patient to have bowel sound because her pregnancy doesn't affect her bowel movement. As for her bowel movement, 3 to 5 days post-delivery of not having her bowel movement. It's not usual, so health teaching should be done. And now, for the lochia, we're gonna check where the mom's pads. The mom's vaginal discharge or the type of bleeding she has should turn different. It turns different colors as time goes by. So this cream white color indicates that it has been 10 to 21 days since the mom had her birth. For episiotomy, it must be kept clean and dry. The dissolvable suture takes 2 weeks to dissolve, so no intercourse 5 to 6 weeks until the tissue has been healed. To check for episiotomy, we will use the RIDA scale. It is the tool that assists the inflammatory process in tissue healing in the perineal trauma. We will evaluate the redness, edema, ecchymosis, discharge, and the approximation of the wound edges. Next, we will check for human sign. To check or to assist, we support the back of the patient knee, then remain flat on the bed and ask the patient or help the patient to dorsiflex. If the patient feels any pain, it means she is positive for human sign, or she has DBT. If there is no pain on both calves, which means she is negative for human sign. Next, for emotional assessment, we will just observe the mother how she has been and how she is with her baby. We can also ask her how she feeling or does she feel any problem or any red flags that need to be addressed.